cooperate, the problem would start, and it would start with you and end with you.
The coronavirus is here, and the requisite precautions should be taken by all. But there is one thing that we shouldn't do, and that's panic.
Do not panic.
Now, with all the knowledge we get from health authorities and all the lifestyle changes we're witnessing, it's easy to freak out about the virus. But it's much more important to be vigilant than continue to panic, according to scientists in the know. So here are 5 reasons not to panic about COVID-19. The virus has already been identified.
You are virus.
There were several other viruses which took some time to recognize. The first reports of AIDS were discovered in June 1981.
You've tested positive for HIV.
It took the scientists more than 2 years to identify the HIV virus. With the coronavirus, the first cases were reported in China in late December, and by January 7, the virus had been identified.
It spreads like the flu.
Knowing the true meaning of pandemic,
COVID-19 can be characterized as a pandemic.
we may identify the coronavirus as a pandemic, of course. But pandemic does not mean it is lethal.
We have never been before seen a pandemic sparked by a coronavirus.
It simply refers to how a virus is transmitted and how far the geographical extension it is spreading. Since the virus is extremely infectious and has spread across at least 3 geographical areas concurrently, it will then be called a pandemic.
Pandemic is not a word to use lightly or carelessly.
Cleaning will remove the virus.
Will these hands now be clean?
One of the bright points about the coronavirus is that it can be washed from surfaces clean. When you use an ethanol solution that contains between 62 to 71% alcohol and hydrogen peroxide or hypochlorite sodium, you can disinfect surfaces when they get contaminated.
And watch out for the disinfectant!
Note also that sometimes washing hands with soap and water is another way we can stay healthy.
Did you wash your hands?
81% of cases are mild.
I'm not going home. I cannot get sick right now. I have way too much to do.
Some people have reported very mild or no symptoms at all. About 81% of those who have tested positive for the virus. However, for 14%, it can cause more severe symptoms, and in 5%, it can become critical or even fatal. Since it is still considered a new virus,
this virus is airborne.
It's not clear what the death rate could be. This could be inferior to some figures so far.
Death is not the enemy, gentlemen. If we're going to fight a disease, let's fight one of the most terrible diseases of all, indifference.
Vaccines are currently being tested.
Vaccine construct that we had already been working on as a team.
Experts from across the world are working on vaccines around the clock to counter the coronavirus. Compare this with the 2003 SARS outbreak when it took more than a year to get to the point we are at present. Or the 1918 flu pandemic, this killed more than 25 million people in less than 25 weeks before a vaccine even began to function.
Certain processes take a certain amount of time.
Human trials are at least a year away.
So as you can see, the powers that be are on top of this virus and making great strides every day. Public officials are monitoring and keeping us up to date and taking the appropriate precautions as necessary. What we need to do now is keep calm, take some easy measures such as washing hands and staying away from others, and most importantly, don't panic.
At the same time, observe again social distancing.
For more informative videos, just click the subscribe button and ring that bell to never miss out.